Sakay natin ito ng konti. Hindi kaya.
Ladies and gentlemen, let's all welcome Ms. Lourdes Carson.
Good evening to our viewers here in the US and around the world. Welcome to today's Focal Point, the show that provides you with knowledge and education about the latest innovations in medicine and healthcare. Join us as we introduce you to some of the best doctors and healthcare providers that you can call for questions about your health concerns. This is your host, Lourdes Garcia. We are broadcasting live, direct from Glendale, California, via the FilipinoCentral.com. Friends, our special guest for today is a well-respected physician in healthcare and medicine. He specializes in stem cell treatments and focuses on changing how we look at traditional and innovative medicine. Dr. Bryn Gerald Henderson. Dr. Henderson is a board-certified physician, a physician executive, and an independent medical examiner. He founded Telehealth Medical Group in the year 2010. He also graduated from law in 1984. His emphasis is on using evidence-based medicine, information systems, and cooperative structures to improve the delivery of healthcare. He also specializes on innovative therapeutic treatments like stem cells and platelet-rich plasma injections, or PRP. Dr. Henderson has a deep desire to create something new, innovative, and meaningful use. He is definitely a change agent, especially in our world of healthcare today. Dr. Henderson will be joining us through teleconference live from Orange County, straight from Telehealth Medical Group. Hello, Dr. Henderson. Are you online?
Hi, Dr.
Hello,
Henderson. How
Dr.
are you doing?
Henderson.
Fine, thank you. Privileged to be here.
Thank you for gracing our show. And that big
Let's
idea
see if
behind your
Dr.
telehealth
Henderson is
medical
on.
group, the stem cells, can you give us more information about them? What are they and why do we need them?
Stem cells are present in our bodies to help improve, repair, and sustain our lives. They replace our dead cells, and they continue to keep our systems functioning by repairing those areas that become diseased or wear out.
And how do they work?
Well, stem cells, by definition, have to have two things. They must replicate. That means they must make new cells, and they must differentiate. That means that they have to be able to create bones, ears, noses, fingers. They have to be able to differentiate all the cells in our body. So we call that potential a pluripotential, meaning they have a plurality of usages.
Oh, tignan mo yung ano.
And so, that being said, that's what they can do. They must replicate, differentiate to qualify as a stem cell. But now, why do they work? Our bodies send out signals. The signals are called chemotaxic factors. That coupled with what they call cytokines.
Okay.
That are for nation. They tell us stem cells where to go and what to make, and where to make new cells. So that's how it works.
Oh, okay. That's interesting. Can you tell us how you obtain them, though?
And how do we obtain them?
Yes, the stem cells.
We obtain them by harvesting them or purchasing them. There's two major kinds. One is autologous, and those are the ones that we get from ourselves. The others are allogenic, those that we get from others. And the autologous ones
Walang
from
volume.
ourselves are obtained from either our blood or our bone or our fat. The allogenic ones
Wala siyang
we
volume.
buy, and those can be obtained from either our amniotic areas, our umbilical areas, or our placental areas. So that's the way we obtain them. We either harvest them or we buy them.
What about compatibility as far as buying them?
That's an excellent question, because one of the
And when you say pure, they are processed in what way?
What happens is that they're identified and grown in a sterile laboratory setting to make sure that they're pure in terms of the type of cells and making sure that there's none other but one kind there. And then that is allowed to grow in a culture medium. And then that is allowed to be approved or rejected by the medical director and the other people watching it clinically.
And is it basically safe for everybody?
The safety in terms of the receipt of stem cells is absolutely safe and done through the correct offices with the means to coordinate the purchase or the harvest in a sterile manner.
And what does the FDA say about this? Did they approve of it?
The FDA is currently establishing different policies and procedures for stem cells. They require licensure, they require processing, and all the parties we work with obey
Naglalaro pa kami.
not only the letter,
Wait
but
lang, pagkain.
the details of the FDA process.
Okay. So if one patient is going to have an infusion of stem cells, how long does the delivery take?
Infusions are that's probably the second most common way in which patients receive the stem cells, and the infusions take about an hour. The injections take about 5 to 10 minutes. Both require processing. The infusions require processing that are at least 2 hours, and the injections require processing that about 30 minutes to a half an hour.
Are there any specific diseases that can be treated with the stem cells, or is it limited only to some?
No, stem cells are not a panacea. They're not good for everything, but they have definitely benefited arthritis and the different disorders of tendons and ligaments and the structural parts of our bodies. That being said, that's the easy part. What is very challenging is to address the chronic diseases, those that are from strokes, those that are from patients that have had head trauma. We've had remarkable success with those. Those also are benefiting that have had blindness from macular degeneration or have had difficulties with diabetes or other complications of breathing, like from 8 years of smoking. So if you are able to secure the correct diagnosis, the patient benefits tremendously by stem cells.
Is it still in clinical trials, or is it out in the market already?
The answer is there are definitely many clinical trials, but there are those of us that are already in the market utilizing stem cells under strict conditions that are FDA approved. So the answer to your question is both.
When you say under strict conditions, what strict conditions?
The conditions that are being targeted are those that are difficult to treat in Western medicine, those that have multiple sclerosis, and ALS, and autoimmune disorders, and where we know we can do a better job. Those are the principal ones we're focused on.
Oh, and how much does it cost for a treatment?
The cost varies with the type of cell, and the stem cells, since they come from many places, can go from anywhere from $3,000 to $10,000. Usually they average between $5,000 to $7,000, and I've never seen any in this country over $20,000.
Oh, okay. Can they be covered with insurance or Medicare?
That's an excellent question, because the insurance companies are approving them on a case-by-case basis on both the HMO and the PPO side. The Medicare, to my knowledge, is not covering any of these until they make a governmental decision.
So I'm guessing most of the time it could be a cash payment for the patients who don't have insurance, or if their insurance companies won't approve of it.
That's absolutely true. There's a lot of cash payments for those things that are not covered.
So do you accept credit cards?
I'm sorry?
Do you accept credit cards?
Oh, absolutely. And the method of payment
Oh, okay. So can you say how effective, if let's say for a macular degeneration disease, like for example, my mom,
Hindi, ano
do you,
yan?
how many
Ah,
treatments do you
Petri dish
think
yan.
does she need
Mga
for
stem
her
cell yan.
to be able to
Yung macular,
recuperate
hindi.
her eyes?
Sa mata yun eh.
Usually what we do with patients that are in the, that we call senior or elderly patients is we usually separate the large treatment in terms of volume into two separate treatments, 1 or 2 weeks apart. So although the younger person may have a single treatment, the older patients receive the same amount of stem cells in two different therapies. Both benefit them, and the effectiveness will vary with many factors. If you would like, I can itemize the effectiveness by those factors. Would that help you?
Yes, of course.
Okay, so the factors that determine effectiveness are things like how long they've had their illness, the duration, the severity of it, and is it mild, moderate, or severe, their age. The older they are, the harder it is. We've treated people up to 101 years old. Their prior treatments, if they had surgeries on their knee, if they had surgeries on their lung, the comorbidities, if they have other illnesses, are they diabetics, do they have autoimmune disorders so that it's hard for them to heal? For heaven's sake, some patients even have cancers. And of course, the current medications make a big deal in terms of determining if there's going to be a response after in concurrent medications that they're on. Excuse me. So we look at the strength and the frequency, the strength of the stem cells, the frequency of the stem cells, within all these factors to determine how effective it will be. And we've had phenomenal stories, mostly, in fact, many are almost biblical in proportions. It's like watching miracles. It's very wonderful.
That's very interesting. So that I'm assuming it's like a systemic treatment for the whole body. Like let's say if you're treating a diabetic patient, then if that patient has some sort of hypertension goes away too, right?
It definitely benefits hypertension to perhaps to go away. Depends again how long have you had it, what is the severity, what medicines are you taking. You definitely benefit rhythms, you benefit many factors.
That's very good, Dr. Henderson. We would like to invite you again next time for our show because we would like to learn more about what you are doing and you're specializing in your stem cells, and we would like to kind of like for you to walk us through with this whole new treatment, and I'm sure a lot of people will benefit from this. Thank you, doctor.
My pleasure.
God bless you. Thank you.
Teka, teka.
You too. Bye-bye. You too. Bye.
There you go, ladies and gentlemen. That is coming from our beloved Dr. Henderson for our show for today. And please tune in for more because Dr. Henderson will be our guest for another series of insights about stem cells and PRPs. And thank you, friends, for watching us live streaming direct on the FilipinoCentral.com. And remember, we walk by faith, not by sight. And together, we can build a strong FilipinoCentral.com. And we would like to thank our sponsors as this show is presented to you by South Main Rejuvenation Clinic and Telehealth Medical Group. Good night, folks. Pangit. Di ako makahinga. Patingin. Oh my goodness, lasing na ako. Halika nga dito. Wala ka kasi. Wala ka. Wala ka eh. Wala ka. Hindi ka